people. Let's work together to try and that will work. So Congress can do one of two things. We can continue to be silent, and that's what we did after Newtown, it's what we did after Navy Yard, it's what we did after all the other tragic events that I mentioned earlier, or we could do something different. We could pull together and we could do something to make our country safer. So it's important that we hear from these experts today, because I believe we should go down the path of let's do something different and let's be safe. And I yield to my colleague and co-chair, or vice chair of the task force, Robin Kelly.
Thank you. I want to thank Leader Pelosi for her leadership in organizing this critical discussion today on the issue of gun violence in America. Chairman Thompson, it's an honor to be working alongside you in this much overdue effort, and I thank the witnesses for their testimony today. The unfortunate truth of today is that we've had over 350 mass shootings in less than 350 days in 2015. As the year draws to a close, it's apparent that this Congress has little appetite to end gun violence. We must own the fact that we are losing a generation of Americans to gun death. We've hit a critical mass, a point at which continuing to turn a blind eye to the epidemic plaguing our nation is just it's not just irresponsible, it's callous. Like many of you here today, I've taken to our streets, to this chamber of Congress, and to the homes of families I love and serve to demand that we do something about this crisis. In the last 2 weeks, you know what's happened in Colorado, in California, and countless mass shootings that did not draw the eye of our national media. All these events occurring as we are set to recognize the 3rd anniversary of the Newtown school shooting. This cannot continue. As the new year approaches, we must not forget the lives that were senselessly halted because we have not owned up to the fact that there is a problem and that we have failed to be concerned enough to get involved. 2015 was a year where the everyday American dream was continually rocked by the echo of gunfire. 2015, this year, when Charleston worshipers were slaughtered as they fellowshipped at Bible study, when a Virginia journalist and cameraman were savagely executed by a jilted co-worker on national television, where 3 people were killed and 7 injured at a Lafayette, Louisiana movie theater because their only mistake was going to the theater during the wrong showtime. Gun violence is crippling America. I represent Chicago, which has seen nearly 3,000 people shot this year and over 400 killed. That includes a 9-year-old boy who was lured into an alley and executed last month in a gang hit. If there's one thing this year that should have been made quite clear, is that gun violence is not just an urban problem or a problem among the mentally ill. It is not contained to a certain social class, a certain part of the country. It's an American problem. I see today's discussion as changing of the tide in our moment as Americans to honor our constitutional rights while responsibly honoring the safety and security of American families. Again, I thank Leader Pelosi, Chairman Thompson, my colleagues, and our distinguished witnesses for caring enough to get involved and for working to make this union more perfect. I yield back. It is now my honor to start introducing the witnesses. Chief Dixon is Chief John I. Dixon III, Petersburg Bureau of Police, Petersburg, Virginia. Chief Dixon was officially installed as the Chief of Police of the Petersburg, Virginia Police Department on September 4, 2007. Prior to joining the Petersburg Police Department, Chief Dixon served the Richmond community for over 24 years, having reached the rank of major with the City of Richmond Police Department. As a law enforcement officer, Chief Dixon has had the opportunity to experience all aspects of policing, and he has a passion for community empowerment and youth engagement initiatives. Some initiatives that have been implemented under the leadership of Chief Dixon are Abatement Compliance and Code Enforcement Program, Police and Community Together, community-based problem-solving workshops, truancy initiatives, and summer youth enrichment program. Chief Dixon has attended several supervisory and management courses and has served a tour in the United States Marine Corps. Chief Dixon is a past president of the National Organization of Black Law Enforcement Executives. Welcome.
And it's my honor and pleasure to introduce Chris Kitaeff. Besides being a lifelong hunter and shooter, Chris is an investor, he's a businessman, he's a former federal firearms license dealer and a board member of Arizonans for gun safety. Chris and his wife obtained their FFL, the Federal Firearms License, in 2012 to start a business with his father-in-law, who operates the business from home and sells at various gun shows. Chris's FFL allowed him to buy, sell, trade, and manufacture firearms. Chris is a firearms owner, regular shooter, concealed weapons license holder, and a student of his business sector. Aside from keeping the books and compliance for his business and helping his father-in-law to generate income out of that business, his goal is to utilize his license, his FFL license, to help reform the firearms industry. Thank you for being with us, Chris.
The Honorable Dr. David Satcher, former Surgeon General of the United States. Dr. Satcher, MD, PhD, is founding director and senior advisor of the Satcher Health Leadership Institute at the Morehouse School of Medicine in Atlanta, Georgia. Previously, Dr. Satcher served as the 16th Surgeon General of the United States and the 10th Assistant Secretary for Health in the Department of Health and Human Services, making him only the second person in history to have held both positions simultaneously. As Surgeon General and Assistant Secretary for Health, Dr. Satcher led the department's effort to eliminate racial and ethnic disparities in health. Prior to his service as Surgeon General, he served as the Director of the Centers for Disease Control and Prevention and Administrator of the Agency for Toxic Substances and Disease Registry. Dr. Satcher was also a contributor to the 2015 Keller Report, Health Disparities in America. Dr. Satcher graduated from Morehouse College in Atlanta, Georgia in 1963 and is a member of Phi Beta Kappa. He holds MD and PhD degrees from Case Western Reserve University in Cleveland, Ohio. He is a member of Alpha Omega Alpha Honor Society and a fellow of the American Academy of Family Physicians, the American College of Preventive Medicine, and the American College of Physicians. Dr. Daniel Webster, Director, Johns Hopkins Center for Gun Policy and Research, Deputy Director for Research, Johns Hopkins Center for the Prevention of Youth Violence. Daniel W. Webster, SCD, MPH, is a professor of health policy and management at the Johns Hopkins Bloomberg School of Public Health. Dr. Webster is Director of the Johns Hopkins Center for Gun Policy and Research, Deputy Director for Research for the Johns Hopkins Center for the Prevention of Youth Violence, and core faculty of the Johns Hopkins Center for Injury Research and Policy. Dr. Webster holds a joint appointment as professor in the School of Education's Division of Public Safety Leadership at Johns Hopkins. Dr. Webster is one of the nation's leading experts on firearm policy and the prevention of gun violence. He is co-editor of Reducing Gun Violence in America, Informing Policy with Evidence and Analysis. He was a contributor to the 2014 Keller Report, Gun Violence in America, and has published numerous articles on firearm policy, youth gun acquisition and carrying, the prevention of gun violence, intimate partner violence, and adolescent violence prevention. Courses taught include Understanding and Preventing Violence, Research and Evaluation Methods for Health Policy, and Graduate Seminar in Health and Public Policy. Welcome.
Now we will be hearing testimony from our panelists. We're going to begin with very distinguished Chief John Dixon.
Good morning. On September 5th, 2010, Jonathan Williams was sitting in his vehicle in Stately Court Apartments when he was shot in the head and killed. Williams was struck by gunfire that was directed at individuals in the area of his vehicle that he had no association with. During the incident, 9 shots were fired by Michael Hilton. Hilton was convicted of murder of Williams and sentenced to 25 years in the Virginia Department of Corrections. On September 8th, 2011, Turnell Rhodes was visiting friends at Jefferson south of the James Apartments when he was shot and killed. Rhodes was involved in an altercation with an individual who has yet to be identified. The offender shot Rhodes one time before fleeing the area. Rhodes, a star high school basketball player attending Virginia State University, was gunned down in the prime of his life. A high school athlete with the potential to have the world in the palm of his hands. Unfortunately, due to senseless argument settled by gunfire and killing, T. Rhodes, his true potential will never be known. On May 4th, 2015, Shakira Ross was shot 4 times and killed while sitting in her vehicle. Ross was waiting for a friend to return her vehicle when the offender approached the residence that her friend was in. The offender noticed Ross in the vehicle and began firing into the vehicle. A total of 8 rounds were shot into the vehicle. The offender in this incident has been arrested and is awaiting trial. Ross was a 2014 graduate of the Governor's School in Richmond, Virginia. I want to thank you all for letting me have this opportunity to be here. Secondly, let me thank the men and women across the country who risk their lives every day, sometimes against unmatched odds, superior training, and firepower in order to keep our communities safe from those who mean to do us harm. We're experiencing mass shootings throughout the country too frequently as public safety professionals. We see horrific gunfire in our communities every day, and we are speaking out because enough is enough. Background checks are critical for the safety of our communities. They keep guns out of the hands of those who are prohibited from possessing them. We know that NICS, the National Instant Background Check System, works. Since the Brady laws was enacted, background checks have blocked over 2 million prohibited purchases from buying guns. We must extend the background check requirement to all purchases. No policy matter has this much public support. Poll after poll shows over 90% of the public supports background checks for all purchases. 88% of gun owners, 86% of NRA members supports this measure. Lawmakers must listen to its law enforcement professionals and the communities that live with this every day. High-capacity ammunition magazines must be limited to 10 rounds. We, as law enforcement professionals, have looked at this matter very seriously and have concluded that 10 rounds would help reduce the number of senseless deaths in mass shootings and give law enforcement the opportunity to respond if confronted by a person's intent on committing such acts. A 10-round limit may also provide someone on the scene an opportunity to take down the shooter when they stop to reload. We also support restricting the sale of new military-style semi-automatic weapons. This will not affect those who already legally own these weapons. These weapons are designed for war and designed to kill as many people as fast as possible. For the sake of our communities and the safety of our officers, we urge the passage of sensible legislation. Again, thank you. God bless you. God bless this great country, and enough is enough.
Thank you very much, Chief Dixon, for your very informative statement. Also, thank you for how you described how our first responders are being trained to reduce violence and the odds that they are up against. Thank you for being here. Now we're going to hear from Chris Kitaeff. His introduction was made by Chairman of our task force, Thompson. I want to join him in welcoming you. Thank you.
Thank you. It's an honor for me to be here to speak with you all today. Growing up in Arizona, I've been exposed to a rich culture of firearms. I have very fond memories of trap shooting with my brothers, duck hunting, camping trips, and spending time with family, law-abiding gun owners. Several years ago, I did obtain my FFL. It was a business I knew about. My father-in-law, who had done so much for me as a young man, was down on his luck. This was something that I could invest in, build around, and give back to someone who had given so much to me. But everyone has a turning point, a moment in time where things change that you can point to. And for me and so many others, it was that December morning nearly 3 years ago, waking up to the Sandy Hook tragedy. I was so disgusted with this industry that had caused so much pain that I was going to walk away. I had the conversation with my wife and other trusted advisors of canceling my license. However, I realized that all that would do would be contribute to the problem. And I remembered legendary Coach Carr telling me one time that you got to not blame anybody, not expect anything, but do something. And that's when I decided I was going to resolve to do everything I could to be a reasonable gun dealer and to speak out for common sense gun laws, to go above and beyond federal law when possible to make sure that guns are kept out of the hands of dangerous people. So what can gun dealers do? as Chief Dixon said, background checks. Brady background checks keep millions of guns out of the hands of prohibited purchasers. As a dealer in Arizona, I've run a lot of background checks. The process is amazingly simple, and most are completed in less than 90 seconds. But in rare cases, when a result takes longer than 3 days to be completed, an NRA-backed loophole allows dealers to make the sale even though the check is incomplete. That means dealers sell thousands of guns to dangerous people each year. The Charleston shooter was one of them. So we've implemented the policy of no completed background check, no sale. And let me be clear, this is not an original idea. One of the nation's largest firearms dealers, Walmart, has implemented this policy since 2002. And not only is this the right thing to do, the common sense thing to do, it will also have no material financial impact on dealers. Let me say that again. As a dealer, not exercising your ability to transfer a firearm to a person after the 3 days before a check is completed will have no material financial impact on your business. These are the numbers. Less than 10% of the background checks that I've run come back delayed. And of those, an overwhelming majority, upwards of 95%, receive a definitive proceed or denied result within that 3 days. So I'm really talking about less than 1% of one's business, 1% of the checks. This 1% is so important. There are potentially dangerous people seeking a firearm. We have the power to close the default proceed loophole, a loophole that has forever changed the lives of so many people around this country. We've also provided a platform for private sales. Every licensed law-abiding dealer in this country is at a material disadvantage due to the private laws or lack thereof when it comes to sale of firearms. It costs a dealer nothing to run a background check. Big misnomer. It costs a dealer nothing to run a background check. We have promoted an environment of a private sales within our FFL. Come in, transfer your firearm at no cost, knowing that you can sleep well at night, that we've done the background check, we've done the paperwork to make sure that you are transferring to a safe or non-prohibited purchaser. You need to train employees, ask questions, really screen for the state of mind in which the person is trying to purchase. So much can be told by one's just general demeanor. 90% of the crime guns are originating for just 5% of the licensed dealers in this country. How many of those guns are taking advantage of this default proceeds loophole? So I advocate for entrepreneurs, small business owners. I support the Second Amendment, but a majority of Americans know that the current system is just not enough. It's just common sense. Things need to change. So I urge those to adopt a code of conduct, such as the Brady Code of Conduct, implement the simple policies to make sure that prohibited purchasers are not getting easy access to weapons. There is materials, ATF provides them online. There's endless webinars that one can take to train their employees. Together we can do this, but we don't need Congress to act. FFLs can go above and beyond to put people in front of profits and stop the nonsense that's taking place. Thank you for your time.
Thank you very much, Chris, for once again providing testimony to us. Thank you for your courageous actions, for your courageous statement here today. It is very valued by us. Thank you. Dr. Satcher, a hero and a panel of heroes there. Thank you for joining us. We look forward to your testimony. Welcome.
Thank you very much, Leader Pelosi, Chairman Thompson, and Vice Chair Robin Kelly. I'm delighted to be able to join you to discuss this very important topic in the lives of the American people. I want to thank you for allowing me to join this distinguished panel. I would like to take the opportunity to make the case for a public health approach to gun violence prevention. In 1996, while I was serving as CDC director and before I became Surgeon General. At that time, Congressman J. Dickey from Arkansas led the efforts on behalf of the NRA to remove the funds so that for 20 years there have been no funds available for gun violence prevention research. Using the public health approach, we have reduced smoking among Americans from 43% at the time of the first Surgeon General's report on smoking and health in 1964 to 18% of Americans smoking today. We estimate that we have saved over 8 million lives because of applying the public health approach to issues related to smoking. Since 1970, using the public health approach, we have reduced deaths from motor vehicle crashes by more than 70%, from approximately 55,000 deaths in 1970 to less than 30,000 deaths today. But during that same period, deaths from firearms have continued to rise due to homicides, accidental gun deaths, and suicides. What is the public health approach, and why is it so relevant to this issue? The public health approach begins by, then it goes to defining the cause, the risk, and protective factors for the problem. For example, what are the characteristics of persons who are at greatest risk for gun violence, death, and what are the characteristics of the persons who are at greatest risk for committing gun violent crimes? How can we intervene to prevent or ameliorate the problem? For example, does educating people about the risk of guns that come with gun ownership and how to reduce that risk make a difference? And finally, we move to develop and widely implement programs using proven strategies to prevent the problem. For 20 years, we have not been able to apply the public health approach to gun violence prevention. Even Congressman Dickey today says it was a mistake to remove the funds, and he has now called for their restoration. Using the public health approach, we have now eradicated smallpox. We've eliminated polio in most countries, reduced motor vehicle deaths, and reduced smoking by more than 1/2. We need to bring the public health approach to bear on gun violent deaths, and we need to do it now. Almost 200 deaths occur each week in America from gun violence. These mostly occur in poor communities among young minority males who have easy access to assault weapons even and to drugs. Another major concern is the increase in mass shootings, which we are seeing throughout the country and some ways throughout the world. But make no mistake about it, while there are over 200 deaths a week from homicides in the streets of America, we've had less than 500 deaths total from mass shootings in the last 15 years. They are both important, but we need to keep that in perspective. We make the following recommendations. Following the advice of now former Congressman Dickey, who provided the leadership in removing the funds for prevention and public health research surrounding guns, Congress should restore those funds immediately and attempt in some way to compensate for all of the years when we have not been involved in this very important research. Secondly, we need to educate the American people regarding the magnitude of the problem of homicide, accidents, and suicides by guns. It's very important to appreciate the fact that there are twice the number of suicides in this country each year than homicides, and that over half of the suicides are carried out with guns. It is also worth noting that we are losing 22 veterans a day from suicide, most of whom use guns. When other means of suicides are used, they are completed less than 5% of the time. But when guns are used, they are completed almost 90% of the time. Thirdly, we need to reduce the ease of access to guns, especially assault weapons and others, with a specific emphasis on keeping them out of the hands of children and those who suffer from mental illness. It should be more difficult to get access to a gun than to get licensed to drive a car. Finally, as you have pointed out, we need a bipartisan approach. I have some great memories from my tenure in government. I remember when Senator Wellstone and Pete Domenici came together across party lines to co-sponsor the Mental Health Parity Act, which was recommended in my report on mental illness. I remember the partnership between Senators Nancy Katzenbaum and Ted Kennedy to pass the Health Insurance and Portability and Accountability Act of 1996. And I remember the commitment of Senator Kennedy and Orrin Hatch for the Child Health Insurance Program. So I have great memories, but I call upon you today to respond to one of the major tragedies of our time occurring on the streets of America every day, and aggressively promote research using the public health approach to prevent gun violence. Thank you very much.
Thank you, Madam Leader. General Satcher, thank you for your testimony. And you brought up the J. Dickey letter, and I had conversations with former Congressman Dickey last week before a press conference we had on the Hill with a number of medical professionals who brought us petitions signed by thousands of medical professionals asking us to remove that Dickey blockade. And he sent me a letter saying, similar to what you said today, and he used the analogy that you alluded to in auto deaths. He said, we studied auto deaths to reduce those, but it was nobody's intention of doing away with all automobiles, although automobiles could clearly end, doing away with all automobiles could clearly end auto deaths. He said the same thing with guns. And what he was concerned about at the time was that it would be used as an effort to do away with all guns. And he said that's ridiculous, would certainly solve all gun violence, but it's clearly something that most people don't want to do. And he called for the repeal of his previous action, and I'd like to ask unanimous consent to deliver that letter for the record.
Yeah. Thank you very much.
Thank you, Leader Pelosi, Chairman Thompson, Vice Chair Kelly. It is indeed an honor to be with you today and be part of this distinguished panel. The nation's attention has been on an alarming increase in mass shootings, but these incidents represent a small fraction of gun violence in the United States. While some policies could reduce the numbers of killed or wounded in mass shootings, my comments today focus on what research tells us about how to prevent more of the over 33,000 firearm-related deaths each year in the United States. There are at least three major ways in which changes to federal gun laws could reduce gun violence. First, higher standards for legal gun ownership would help. Currently, a person can legally buy as many guns and as much ammo as they'd like and carry that around with them in most states almost anywhere they'd like, even if they've been arrested and convicted for numerous crimes involving violence, guns, and alcohol, as long as those acts have not resulted in a felony conviction. An individual can also have numerous prior restraining orders or even a current emergency restraining order for domestic violence, and that is not a legal barrier to having or carrying guns in most states. When states have raised standards for legal gun ownership, research has documented reductions in violence. Second, Congress could heighten accountability measures for federally licensed firearm dealers to reduce the number of guns being diverted to criminals. The number of guns that are diverted to criminals is closely linked to whether gun dealers face consequences for not complying with gun sales regulations, according to several studies that I've led myself. But Congress has shielded licensed gun dealers from such consequences. Finally, and most importantly, background checks and record keeping for all gun transfer from criminals. When you couple that those universal background check requirements with handgun purchaser licensing, not unlike what we get when we go to get a